Let's fix that low back and SI joint pain. Hi, my name is Brandt Passalacqua, and I am the founder of Breathing Deeply Yoga Therapy. We've trained thousands of yoga therapists to be effective in the world. And one of the things, of course, we work with all the time is back pain. I wanted to make this video because a lot of people come in with either lower back instability or SI joint dysfunction. SI joint dysfunction in itself accounts for 15 to 30% of all cases of back pain. And then additionally, when you kind of put that into other lumbar things that present in the same way, you really get up to 57% of cases of back pain. So you might think to yourself, what does yoga therapy have to offer me? And it offers quite a bit. We take a little bit more holistic view of our clients. So we're able not only to use the keys and the information you have about your pathology, we look at MRIs and other things and everything your doctors might have said, and then create plans that will do two things. They correct the instabilities in your system so that you can support your SI and lower back more effectively. And then they also teach you different movement patterns so you don't keep re-injuring yourself. This can look different for every client, but what I will say is working with a Breathing Deeply yoga therapist will put you in a position to really learn about your own body and the best ways to solve your pain. What you'll see next is a really brief interview I did with a client of mine who came in with thigh instability and a lot of pain that really took her down for long periods of time and out of the things she wanted to do with her life. And now she's able to do all those things again. So I thought that might be helpful, especially if you're interested in looking for your next step in terms of back pain. So don't live with back pain as a chronic condition and don't think it can't be solved. Please comment below and contact us if you need any help solving your pain problems. Thanks for listening, and I hope you enjoy the interview. I am here with Sarah Lynn. We worked together. She was a client of mine. She came to me for some back pain and thought it might be useful for people to hear your story and how it worked out for you. So thanks for doing this. Appreciate it.
You're welcome.
So why don't you tell us just a little briefly, like the history of your back pain, why you came, what was the problem?
It started about 15 years ago when I was on a parking lot that was a sheet of ice, and I went to climb into my car, and one foot was in the car and one foot was still out, and it slipped out from under me. And I have had issues with it ever since. And I tried chiropractic, physical therapy, a lot of massage. And then what ended up working was stretching with yoga, but it never really truly got better. I was just able to deal with it until we started doing the strength training part of yoga and not just the flexibility. And I've had a lot more decrease in pain, like pretty instant. Like within a month, I think I started noticing a lot less pain and got it down to, I think we got it down to about once a month. It would start to aggravate me, but throughout the whole duration, we were able to get it to where I can take care of it myself. I don't have to go to a chiropractor anymore. I don't have to get dry needling done anymore.
So that was the big thing. You were getting all these treatments. This is what I remember. You were getting all these treatments. Really bothered you. If you took a hike or something you wanted to do, a long walk, you would.
Any kind of exercise, yep.
It would take you out a little bit for several days. Am I remembering correctly? Or longer?
To a couple of weeks, depending on what I did.
Yeah. And so you had tried, and you're a yoga practitioner, you're a massage therapist, lots of things.
Yeah.
So you had tried lots of things, right? You had put tennis balls in there and heat and cooling and needles and chiropractic.
So it was pretty much constant care of my back. If I wanted to be active in any way, I was constantly doing something to try to ease the pain and like the seizing of the muscles.
And then if I remember, it was around the time of your period, it would get worse or it'd be easier to throw it out, right?
Oh, yeah. And that's the time of one time a month. It still will get really tight from the seizing, but I'm able to just fix it that day in the morning with movement and exercise.
And so what we discovered in our process together was that, and this is probably like a good demonstration of why yoga therapy can be like really effective, because we panned back and said, okay, what muscles are weak and what's possible. I remember you were surprised because I was like, I don't think your glutes and your squat, your hip flexors and these muscles are strong enough for what you're doing. And you were a little surprised by that because you're an active person, right?
I'd been climbing mountains, so I didn't
Yeah.
know that that would be possible, but
Yeah. You
it
live in
was.
Alaska, you walk up big hills all the time. And I was like, when I see this, it looks a little weak, and especially on one side. This is part of yoga therapy training that at least all of our yoga therapists go through. We figured out what was weak and strengthened it up, which didn't really take you that much time, right? Like per day,
No,
anything. It wasn't a big,
maybe 15 minutes.
yeah, yeah. So,
I don't think I ever really timed it, but it really wasn't that long at all.
so 15 minutes a day. So,
I started with every other day, and that
right.
actually worked really well. And then I sat for 2 or 3 weeks and didn't do anything, so then we switched it to every day, and that's when I really saw a lot of improvement.
Mhm.
But now I don't have to do it but 2 to 3 times a week.
2 or 3 times a week. I declare victory for yoga therapy interventions sometimes because you're a really good example of someone who had done sort of everything. You had really tried to solve this problem. And would it be accurate to describe your headspace as believing that this was going to be like a permanent kind of situation, like when I met you, right?
It was discouraging because I still wanted to be quite active, but
Yeah. Yeah. And when we started working together, for me, it was a little tricky because I was like, okay, she's done all these things. Then I said, why don't I just pay him back and treat her like anyone else? Maybe they didn't work, or maybe there's something we could do. So, yeah, we came up with some really simple movement patterns for you that worked amazing. And so I guess we should finish this by telling everybody what you do now with that back of yours, where it would be out for 2 weeks. Are you able to hike up mountains again?
yes.
So that's exciting.
The other thing that actually just happened in the last maybe 2 months that I've been really excited about is I can now, having learned with you what my kind of back can handle and what maybe I shouldn't be doing, I'm able to actually still do like the exercise things that I enjoyed in the past videos or whatever sequences by just learning to modify them a little bit and learning how to modify them for myself and actually like paying attention in my body to what I'm doing and just slowing everything down. And so it's been really cool because now I can actually exercise and do these things that I want to do, plus hike, and not, I'm recovering. I don't have to do them every single day. Learning how to balance my body or like what my body can handle versus trying to do really hard exercise every single day. It's okay, I'll wait a day or two until I do something else and just learning how to work with my body so that it doesn't do that, but to keep active.
Yeah. And you're super active compared to most people. You're super active. When I met you, I was like, oh, her bar is pretty high. She's like, why can't I climb this mountain? Something's wrong with me.
And
And
hike 13 miles.
yeah, yeah, we didn't mention that. When Sarah Lynn says hike, she means 13 miles. She doesn't mean a mile. It's pretty impressive what you were able to accomplish in a short period of time. And I really hope this gives some people some inspiration because lower back and SI pain is everywhere. Huge percentage of people have it. And in my mind, there's no reason that a very large percentage of people can't find some relief if they go through the right process. It was lovely working with you, and I'm super happy for you. And if I can get my cardio up, I'll join you on a 13 hike someday. Thanks for talking with us.
Thank you.